Healthcare system costs associated with diabetes begins with $727 billion in 2017 for diabetes as a condition and its complications. But it's far-reaching because it's beyond the economic costs. Really, we have to consider the social costs of people with diabetes and their families.
I mean, it's almost inconceivable, those figures. I mean, it's hard to get our head around that amount, that $728 billion of direct cost to healthcare. It's inconceivable. One of the facts that I'm aware of is that if diabetes was a country, it would be the third largest country in the world. And I think that just really puts it into perspective, not only the cost to healthcare systems, but also the cost to individuals. I think Jane's already mentioned about the indirect costs. So there's indirect costs that we talk about in terms of financial costs, but those indirect costs to the patient, their own fear of the future, their own provision of their own family members through their economic involvement of their disease and how they're managing that disease. These things are big issues for not only for individuals, but for countries alike.
And these costs are only going to increase with population ageing, because we know that by 2050 there'll be 2.1 billion people who are aged 65 and over. And by 2045, there'll be about over 600 million people with diabetes. You know, just in 2017, 3.8 million people died of diabetes and its complications. But we need to go beyond that and look at the vision complications and how that impacts their function, their independence, and their identity and community.
The DR Barometer project is very important in identifying some of the key areas of weaknesses in our management of patients and how the understanding and education between people living with diabetes and healthcare professionals managing diabetes can be brought together to improve it for all of us. Now, I think one of the key straplines that goes along with the DR Barometer is shifting the needle, and that shifting the needle is key. It's moving from where we are now to where we should be, and we can only do that if we involve and we engage everybody in that process of shifting that needle.
The three key areas that the DR Barometer program will be built on are three key areas that were evidence from the DR Barometer from many, many countries, and that is the patient education and empowerment, the importance of it, the lack of awareness people have. Secondly, the importance of a coordinated approach to care. And in many countries, coordinated care is going to be meaningless. And yet we actually have to understand the cultural nuances of a person with diabetes and their risk of eye complications and do our best to bring together the pieces of a coordinated care approach. And finally, guidelines and protocols. You know, we have them, they're not used in many situations, and so that must also be a key underpinning, a pillar of the DR Barometer. And not only do we have them talking, but we have them buying into the problem, the solution, and the action that they will be taking together. And that's where I see we've taken an idea from IAPB, from IDF, from IFA, from Bayer. We've taken the idea, we've got the evidence, we've got study, and now we're moving into the action and a program throughout the world.